Hello, everyone. This is Sarah Mack, President of the Illinois Mental Health Counselors Association, or EMCA for short. Today, we are going to be going over a counseling technique called the empty chair. So, what we are going to do in today's video is we are going to, again, learn about the empty chair, where it originated, how it works, what it's helpful for, and things like that. So, one of the websites that I usually direct clients to if they want to learn more information, after I explained a lot of stuff to them, is Psych Central. As you can see here, we're going to go over the empty chair. All right, so let's get into it. Alrighty, so first, origins of the empty chair technique. All right, so the empty chair technique was popularized by Gestalt therapists, but it was first developed and demonstrated by Jacob Levi Moreno, a student of Sigmund Freud's in 1921. Moreno objected to the reflective nature of psychotherapy and opted to develop a technique focused more on active engagement. In the following years, he used the empty chair technique in group context termed psychodrama. Gestalt therapists were the first to use the empty chair technique in a one-on-one context. The core components of the empty chair technique are exploring emotions, movement between chairs, dialogue with another, either in imagining another person or an aspect of oneself. In some cases, the method can involve several chairs. A person with negative thoughts about themselves may place those automatic negative thought patterns into an empty chair as they arise, giving the person a new perspective. Although experiencing emotions in the present moment is central to Gestalt therapy, practitioners of this technique emphasize that the individual is always understood in a context including their past and present environments and experiences. All right, so now let's take a look at what is the empty chair technique. The empty chair technique, also called the two-chair technique or simply chair work, is a therapeutic method used in talk therapy. Its objective is to start a conversation with parts of oneself or individuals from a person's past or present. During an empty chair session, a person may speak to an individual or an aspect of themselves they imagine sitting in the empty chair. Sometimes the person will then switch places, taking on the role of that aspect or person. The idea behind the empty chair technique is to resolve conflict specifically by increasing awareness in the present moment. All right, so now let's take a look at who is the empty chair technique best used for. Gestalt therapy emphasizes re-experiencing events and interactions that may be at the root of emotional distress. The best candidates for this kind of therapy are people who may be open to a potentially intense therapeutic experience. The empty chair technique may have broad application, but it's not suitable for everyone. Two experts on the empty chair technique, Scott Kellogg and Amanda Torres, stated in a 2021 publication that the method might be most helpful for people with the following: depression, anxiety disorders, interpersonal mistreatment, grief, personality disorders, socially induced trauma, inner conflict, and self-hatred. Research has demonstrated the effectiveness of the empty chair technique in a specific use cases. A 2020 study of 12 people with depression who participated in the empty chair method as part of compassion-focused therapy found that it helped to change how the participants related to themselves. A 2014 study of Bosnian women who had lost husbands in war found that Gestalt empty chair therapy and group therapy effectively improved symptoms of certain mental health conditions. All right, let's go over the steps. So, empty chair technique steps. The steps of the empty chair technique depend on the individual therapist and the person participating in therapy. Before you start Gestalt therapy or engage in an empty chair session, you may want to ask the therapist how they typically conduct a session. Some basic steps may form the basis of most empty chair sessions in therapy. So, step one, identifying the object. Through discussion with a therapist or counselor, you might identify whom or what you like to speak with in an empty chair dialogue. For example, your therapist may recommend a conversation with a metaphorical emotional wall that appears at certain times, or they may suggest talking to someone who has passed on near or around the anniversary of their death. Step two, conduct the dialogue. With the therapist's help, you could talk to the aspect of yourself or the person you imagine being in the empty chair. If the object is an aspect, you might play that role and answer your questions. For example, in the case of the emotional wall, your therapist might ask why you appear and what would happen if you did not. Step 3, switching places. Often you will switch places and play the opposite role with the person or aspect you're talking to. The way this manifests depends on your goals in therapy. Some people may want to work through unresolved feelings, find closure after a traumatic event, cope with grief. All right, step 4, assessment and discussion. After an empty chair session, your therapist may want to debrief with you. You may be encouraged to discuss the conversation and how you felt. All right, now let's get into possible effects. So, the empty chair technique may help you resolve emotional issues that have roots in your past or involve a person currently in your life. Some possible positive effects of the method include finding closure on a past difficult relationship, reducing harmful thoughts towards yourself, experiencing greater insight in your own feelings. Like all forms of therapy, the empty chair technique may not work for everyone. You may not receive the emotional benefits you seek. It's possible your therapy could help you achieve peace, but in the process cause you to experience a negative domino effect on your family relationships. You may have to adjust how you function in life, which may be a new source of stress or unexpected challenges. So before you begin Gestalt therapy or engage in an empty chair session, it may be beneficial to talk with your therapist about possible outcomes for you. So this was last medically reviewed on October 14th, 2021. And here are 11 sources that the article pulled from. If you guys want to take a look at that. All right. So now what I'm going to do, I'm going to give my thoughts and what I've used empty chair for. Alrighty. So that was the empty chair technique. So ultimately what I've used the empty chair technique for was through a lot of crisis and trauma, especially with interpersonal relationships and things like that. So when I used to work at my inpatient crisis center, empty chair technique was one of the main things I used to help clients there really confront what it is that they were trying to overcome and to help them normalize, talking about it, expressing different things, and really feeling those emotions to help them see that, A, they're in control of their emotions and not the other way around. Right, but the empty chair technique is a really great technique to utilize, and it does help out a lot. So if that interests you guys, then definitely feel free to utilize the empty chair. All right, if you guys made it to this part of the video, then that's it. Thank you guys very much for watching. If you're looking to learn more information about IMCA, or the Illinois Mental Health Counselors Association, you can go to imca.org. Give us a call at 815-787-0515. Or you can email us at myimca@gmail.com. Like I said, we are always interested in hearing from you guys what you want us to see, or if you're interested in doing an interview with us to help promote your private practice, then let us know as well. All right, thank you guys very much. Have a great rest of your day. Bye-bye.